Tiaprofenic acid is a nonsteroidal anti-inflammatory drug NSAID that is used for its anti-inflammatory, analgesic pain-relieving, and antipyretic fever-reducing properties. Its pharmacology involves several mechanisms of action. Inhibition of cyclooxygenase COX. Tiaprofenic acid, like other NSAIDs, works primarily by inhibiting the activity of cyclooxygenase enzymes, specifically COX-1 and COX-2. These enzymes are involved in the production of prostaglandins, which play a key role in inflammation, pain, and fever. By inhibiting COX, tiaprofenic acid reduces the synthesis of prostaglandins, leading to its anti-inflammatory and analgesic effects. Anti-inflammatory effects. By reducing prostaglandin production, tiaprofenic acid helps to decrease inflammation in tissues. This can provide relief from conditions such as arthritis and other inflammatory disorders. Analgesic effects. Tiaprofenic acid's ability to inhibit prostaglandins also contributes to its analgesic properties, helping to alleviate pain. Antipyretic effects. Tiaprofenic acid can lower fever by reducing prostaglandin production in the hypothalamus, which is involved in temperature regulation. Platelet aggregation inhibition. Tiaprofenic acid may also have some antiplatelet effects, although these are less pronounced compared to other NSAIDs like aspirin. Pharmacokinetics. Tiaprofenic acid is administered orally and is readily absorbed from the gastrointestinal tract. It is metabolized in the liver and excreted primarily in the urine. Pain and inflammation. The typical starting dose for adults is 300 to 600 milligrams MD, taken orally 2 or 3 times a day. This can vary depending on the severity of the pain or inflammation. The maximum daily dose should not exceed 1,800 milligrams. One of the most common side effects associated with tiaprofenic acid, like many other nonsteroidal anti-inflammatory drugs NSAIDs, is gastrointestinal irritation. This can manifest in various ways and may include stomach upset. Many people may experience mild stomach discomfort, nausea, or indigestion when taking tiaprofenic acid. Gastric ulcers. NSAIDs, including tiaprofenic acid, can increase the risk of developing gastric ulcers or stomach ulcers. These ulcers can lead to more significant symptoms like abdominal pain, vomiting of blood, or black, tarry stools. Gastrointestinal bleeding. Prolonged use of tiaprofenic acid at high doses or in individuals with a history of gastrointestinal issues can lead to gastrointestinal bleeding, which can be serious and may manifest as blood in the stool or vomiting of blood. Increased risk for elderly. Elderly individuals are at a higher risk of experiencing these gastrointestinal side effects, as well as more severe complications. Therefore, they are often prescribed lower doses or alternative medications when possible. Tiaprofenic acid, like other nonsteroidal anti-inflammatory drugs NSAIDs, can interact with various medications and substances. Some of the most common interactions to be aware of include other NSAIDs. Concurrent use of multiple NSAIDs, including tiaprofenic acid, can increase the risk of gastrointestinal bleeding and other side effects. It's generally advisable to avoid using more than one NSAID at a time. Anticoagulants and antiplatelet drugs. Tiaprofenic acid can interfere with the function of blood-thinning medications such as warfarin, clopidogrel, and aspirin, potentially increasing the risk of bleeding. Corticosteroids. Combining tiaprofenic acid with corticosteroids, such as prednisone, can increase the risk of gastrointestinal ulcers and bleeding. Your doctor may prescribe a stomach protective medication if you need to take both types of drugs. Selective serotonin reuptake inhibitors SSRIs and serotonin norepinephrine reuptake inhibitors SNRIs. There is a potential for an increased risk of bleeding when SSRIs or SNRIs are taken concurrently with tiaprofenic acid. Certain blood pressure medications. Tiaprofenic acid may reduce the effectiveness of certain antihypertensive medications, potentially leading to an increase in blood pressure. Methotrexate. Concurrent use of tiaprofenic acid and methotrexate can increase methotrexate levels in the blood, leading to potential toxicity. This combination should be closely monitored by a healthcare provider. Lithium. Tiaprofenic acid can increase lithium levels in the blood, which can be toxic. Regular monitoring of lithium levels is essential if these drugs are used together. Diuretics. The effectiveness of diuretics water pills can be reduced when taken with tiaprofenic acid, potentially leading to reduced blood pressure control. Alcohol. Drinking alcohol while taking tiaprofenic acid can increase the risk of stomach irritation and ulcers. It's advisable to limit or avoid alcohol consumption during NSAID therapy.